so my name is Carrie Kogan and I'm going to be performing my NR 509 physical examination today on my patient. Can you go ahead and tell me your full name?
Nelson Luna.
Perfect. And the patient is consenting to go ahead and be part of this physical examination for NR 509. Do you give consent?
Yes, I do.
Perfect. And you're okay with Chamberlain using this information?
Yes, I am.
Perfect. Go ahead and tell me your birthday.
March the 1st, 1985.
Okay, and what year are we in?
2023.
Okay, and where are we at right now?
Newport Beach, California.
Perfect. So patient is alert and oriented ×4. I'm going to go ahead and perform an environmental scan. Okay. So I'm first going to start off my assessment by observing the patient's face. It is symmetrical and there is no lesions, no abrasions, or any other abnormalities. Next, we're going to go ahead and assess the head. So I'm noticing that the head has fine distribution of hair. There's no abscesses or no lesions as well. Next, I'm going to go ahead and assess the patient's lymph nodes. Okay, are you okay if I touch your face?
Yes.
Okay. So this is the pre-auricular, post-auricular, occipital. I'm going to go ahead and turn that way so they can see too. Occipital. Then we have the tonsillar, supramandibular, submental. We have the anterior cervical, posterior cervical, and then the supraclavicular. So there are no large lymph nodes noted. Next, I'm going to go ahead and assess cranial nerve number 5, which is trigeminal, okay? So I'm first going to go ahead and palpate right here on the sides of your face. Go ahead and bite down for me. Okay, there's no distortion. Patient has good strength bilaterally. Okay, next I'm going to go ahead and use my finger and I'm going to have you close your eyes and I want you to distinguish where I'm pointing on your face, okay?
Okay.
Close your eyes. Go ahead.
My forehead. My cheek. My right cheek. My nose. My chin.
Okay, perfect. So cranial nerve number 5 is intact, trigeminal. Patient was able to appropriately respond to all the questions and appropriately respond with facial symmetry. Next is cranial nerve number 7, which is facial. So I'm going to have you smile for me.
Smile.
Smile. Okay, frown. Like make a frowny face. Okay. And go ahead and puff up your cheeks. Okay, and then can you pucker up your lips?
Pucker up my lips.
Perfect. So cranial nerve number 7 is intact. There is noted facial symmetry. There's no drooping or any other abnormalities noted. So after cranial nerve number 7, we are going to go ahead and do an inspection of the ears, okay? So I'm first going to take a look at both ears. Okay, they're both symmetrical. There's no drainage or lesions noted upon both of them. So now I'm going to use my otoscope with the light. I'm going to pull the pinhead back and up. Take a look. Okay, I'm going to do the same thing on the other side. Pull the pinhead back and up. Okay. So it's noted that in bilateral both ears, the tympanic membrane is pearly gray. And there is no effusions, there's no drainage, there's no lesions, there's no erythema, and no cerumen in both ears, okay? So now I'm gonna go ahead and perform cranial nerve number 8 test, which is acoustic, okay? So I'm gonna whisper in your ear 3 words on both sides and you have to repeat after me, okay?
1, 2, 3. 4, 5, 6.
Okay, so cranial nerve number 8 is intact, which is acoustic. Patient was able to verbalize correctly to all words. Okay, so after we went ahead and assessed your ears, I'm just going to palpate your tragus and your penis and know if there's any lymph nodes. No lymph nodes are noted. So after your ears, we're going to go ahead and inspect your eyes, okay? So I'm going to go ahead and pull down and look at your sclera. Go ahead, look up. Okay. There's no drainage or lesions. The conjunctiva is clear. We have the sclera that is white and no drainage. Okay. So next, I'm going to go ahead and hold out my pocket Snellen chart. And I'm going to stand 6 feet away. Can you try to read the bottom one?
LTFPH.
Okay, now cover your left eye. Okay, can you go ahead and repeat that?
LTFPH.
Okay, and then your right eye. What is the smallest line you could see?
Smallest one I could see is the LTFPH.
Perfect. So patient has 20/20 vision in both left and right eye and both eyes symmetrically. So next we're gonna go ahead and check your peripheral vision. So I'm gonna place my hands behind you and once you see them, let me know, okay?
I see them.
Okay. How about now?
I see them. I see them.
Okay. So peripheral vision is intact. Next, I'm gonna go ahead and flash a light into your eyeballs to go ahead and assess your pupil symmetry, okay? So just look straight forward, look at my nose. Okay. So pupils are equal, round, and reactive to light with 2 to 3 centimeters in diameter to constriction of light. Okay, so after your eyes, we're gonna go ahead and assess your nose. So the nose is midline and symmetrical. There's no lesions, there's no drainage, there's no polyps noted or obstructions. So with my ophthalmoscope, I'm gonna go ahead and place this inside of each nair. And I'm gonna angle it towards the septum. Okay. So I didn't notice any bleeding, any bruising, any erythema, any drainage or obstruction or polyps. The midline septum, or the septum is midline and there is no bogginess, okay? Next, we're gonna go ahead and assess your frontal sinuses. Do you feel any tenderness?
No.
And then maxillary. Any tenderness?
No.
Okay, perfect. Next, we're gonna go ahead and assess the mouth. So the lips are pink and moist. Now I'm gonna have you open up your mouth for me. I'm gonna flash my light in there real quick. Okay, so I'm noticing that there is no sign of tooth decay. Gums are pink, healthy, and moist. The tongue is pink, healthy, and moist. Can you go ahead and lift under your tongue? Under the tongue is pink, healthy, and moist. The floor of the mouth has no nodules, no lesions, or abrasions noted. I'm looking at the posterior pharynx. Go ahead and open again for me. There is no redness, swelling, or postnasal drainage that is noted, okay? Next, we're gonna go ahead and assess cranial nerve number 10, which is the vagus nerve. So I need you to say ah for me.
Ah.
Okay, cranial nerve number 10 is intact. The uvula is midline and symmetrical, and the soft palate is also pink, healthy, and moist, okay? Next, we're gonna go ahead and assess cranial nerve number 12. So for cranial nerve number 12, I need you to open your mouth, okay? Try to stick your tongue up, down, side, side. Okay, so cranial nerve number 12 is intact, okay? Next, we are going to go ahead, after we assess the mouth, assess the neck. Okay, but before that, I'm going to go ahead and assess the TMJ, which is the temporomandibular joint. Okay, go ahead and open. Close. Okay, so I didn't notice any clicking, any distortions, no sublumination, and the patient has equal strength bilaterally. Okay, next we're going to go ahead and assess the throat. So I'm looking at the throat on both sides. It looks midline. I'm going to go ahead and palpate for the thyroid. Next, I'm going to palpate the pharynx. The pharynx is midline. Okay. Next, what I'm going to do is go to the carotid space and then also go to the suprasternal notch and retract and palpate. Go ahead and swallow for me. Okay. I'm going to do that on the other side as well. Go ahead and swallow. Perfect. Again, I'm palpating the thyroid. There is no bulging, no masses or nodules that are noted. I'm going to go ahead and assess cranial nerve number 11, which is the spinal accessory muscle, okay? So what I'm going to have you do is lift up your shoulders. Can you shrug them against my hands? Perfect. So cranial nerve number 11 is intact. Next, I'm going to go ahead and assess for the patient's heart sound, okay? So using the diaphragm of my stethoscope, I'm going to go ahead and listen at the second intercostal space on the right sternum border for the aortic valve. Then I'm gonna cross over to the second intercostal space left sternum border for the pulmonic valve. Then I'm gonna turn the bell of my stethoscope over and go to the third intercostal space left sternum border, which is the Erb's point. Next, I'm gonna flip over my stethoscope back to the diaphragm. We're gonna go to the fourth intercostal space left sternal border, which is the tricuspid valve. Then we're gonna go to the fifth intercostal space, mid-clavicular line, and listen to the mitral valve. Okay? So S1 and S2 are present.
Sorry.
It's okay. So S1 and S2 are present. There's no murmurs that are noted. Next, I'm going to go ahead and inspect the patient's chest and look at their breathing. Breathing is symmetrical. There's no labored breathing or adventitious sounds noted. I'm first going to inspect and auscultate on the anterior side, the 6 lung fields. Make sure that the diaphragm is on. Nice big deep breath. Okay, now posteriorly, I'm gonna have you, if you can just flip that way. Perfect. Posteriorly, I'm gonna listen to 8 lung fields. Big breath. You can go ahead and turn back around. So the patient is able to breathe symmetrically, breath sounds bilaterally are clear, and no adventitious sounds. Next, I'm gonna go ahead and assess the bilateral upper extremity. So I'm looking at the skin right now, and there is no lesions. The patient does have a tattoo on his left upper arm. Other than that, there's no abrasions or anything else, and I don't notice any edema as well. So I'm gonna go ahead and feel for your radial pulse. Okay, radial pulse is +2 bounding, which is a normal finding. Next, I'm gonna go ahead and test your grip strength. Go ahead and squeeze my 2 fingers. Go ahead, let go, perfect. Patient has 5 out of 5 strength bilaterally in upper extremities. Now I'm gonna have you go ahead and lift your arms up, down, to the side, back up, back down, and then rotate your shoulders. Perfect. So patient has good strength, 5 out of 5 in bilateral upper extremities. So now after this, we're gonna go ahead and check the deep tendon reflexes. So what I'm gonna go ahead and do with the pointy part of my hammer, I'm gonna go ahead and hold the patient's arm out. Go ahead and bend. I'm gonna have it at the antecubital fossa area and go with my hammer. Okay, there's small twitching there. We're gonna go ahead and check the patellar reflex, so go ahead and relax. And I'm gonna use the flat side of my hammer. Okay, the patient had small twitches, which is a normal finding. Next, I'm gonna go ahead and check the Achilles tendon, where I'm gonna dorsiflex the foot slightly and look for the tendon. And I'm using the flat part of my hammer. Okay, there's slight twitching. Patient is responsive to all deep tendon reflexes. After this, now I'm gonna go ahead and have you lay down so I can inspect your stomach. For the purpose of this video, we're using chairs since we are limited on equipment. Okay, so I'm looking at the patient's abdomen from this side, and I'm looking for any types of masses, any bulging, any contouring. The patient's stomach is flat and non-distended. Is it okay if you go ahead and slightly lift up your shirt for me? Perfect, thank you. So now I'm gonna go ahead and auscultate in all 4 quadrants for vowel sounds. Starting with the right lower quadrant. So vowel sounds are present in all 4 quadrants. Now I'm going to go ahead and switch to the bell on my stethoscope so that way I can listen to the abdominal arteries. First I'm going to start off with going right below the xiphoid process to auscultate the aorta. Next I'm going to go ahead and move to the left renal, which is lateral above the umbilicus. Then I'm going to go ahead and do the left iliac artery, which is laterally below the umbilicus. Next, we're going to go ahead and go to the right iliac, which is laterally to the right of the umbilicus, below. Next, we're going to do the right renal artery, which is laterally above in the right side of the umbilicus. Okay, perfect. So there was no root that was noted. We've finished our auscultation for the abdomen. So now I'm going to go ahead and check for tympany. What I'm looking for is tympany and dullness over the abdomen. So there's tympany over all 4 quadrants, and then there was also dullness felt over the liver and the spleen, which are normal findings. So now I'm going to go ahead and palpate in a circular motion. If you feel any pain, please let me know, okay?
Okay.
Any pain?
No.
No? Okay, so now I'm going to perform the Bloomberg's test, which I'm going to have my hand at a 90-degree angle and go ahead and strike it in both the left and right lower quadrant. Let me know if you feel any pain.
Okay.
Okay? Okay, so Bloomberg test is negative, which is a negative finding, which is a good result. Now we're going to go ahead and assess the liver. So I'm going to place my left hand on the right side of the coastal vertebral angle, and I'm going to go ahead and palpate. Go ahead and hold your breath in for me. Okay. So the liver does not go beyond the coastal vertebral angle, which is a normal finding. I'm going to have you slightly turn towards your right, towards me a little bit. Perfect. So now I'm going to place my right hand on the left coastal vertebral angle, and I'm going to go ahead and palpate for the spleen. Go ahead and hold your breath in for me. Okay, there is no extra sensation or feeling beyond the coastal vertebral angle of this spleen, so that is a normal finding. You can go ahead and close your shirt. So after the abdominal assessment, I'm going to go ahead and inspect the patient's bilateral lower extremities. I'm just going to lift up to kind of see the skin. Okay. So the patient doesn't have any edema that's noted. The skin is pink and moist. There are no lesions or any abnormalities found. Now what I'm going to go ahead and ask you to do is go ahead and flex your hips up. Are you able to flex up? Okay, flex down. Okay. Are you able to slightly bring your shin to your chest? Just one of them, at least. Okay. So now we're going to go ahead and check for abduction and adduction. I'm going to turn it this way a little bit. Any pain? For the purpose of the simulation, the patient is able to do both hip and knee flexion, abduction, and adduction, has a good range of motion. Next, I'm going to go down to the ankles. So go ahead and keep your foot straight out for me. So at the ankle, I'm going to go ahead and have you lift your toes towards you. Perfect. Now push. Push towards me. Okay, and then now pull against resistance. Go ahead, pull towards you. Perfect. Now push. Okay, can you rotate your ankle in a circle? Okay. I'm going to go ahead and take off your shoe really quickly so that way I can palpate the dorsalis pedis. I'm going to take off the other shoe as well really quickly just so I can palpate them symmetrically. Sorry. Okay, so dorsalis pedis are palpable +2, strong and symmetrical. So now I'm going to go ahead and have you stand up for me. I'll go ahead and move this over for you. Okay, so now I'm going to go ahead and assess the patient's spine. Turn that way for me, please. Okay, so I'm assessing the patient's spine. I'm looking for any curvatures, any abnormalities, or any malignancies. Okay, can you bend forward for me? Okay, I'm feeling the spine again, palpating. Okay, and then can you bend backwards? Okay, and then can you go side to side? Okay, so patient doesn't have any abnormal curvatures noted in the spine. It is straight and symmetrical. Patient is able to have full range of motion in the spine. So next, what I'm going to have you do is face me. Okay, I need you to close your eyes, and I'm going to place my hands to the sides of you, and this is the Romberg's test. For 20 seconds, I'm going to assess the patient, notice if he has any swing. Okay, Romberg sign is negative. The patient passed the test without swaying for 20 seconds. Lastly, I'm going to go ahead and ask you to walk 5 steps that way and 5 steps back. So right now I'm assessing the patient's gait to see if he is steady, if he's able to have good coordination. Perfect. And then lastly, before I forget, go ahead and take a seat for me. We're going to do the cerebellar movement test, okay? We're going to check your coordination. So I want you to do this. Can you coordinate each finger to your thumbs? Okay? And then next, we're going to do rapid alternating movements. So I want you to go like this on your knees, on your wow, yeah. Okay, go ahead. So I'm assessing the patient has good coordination. Do you have any questions for me?
Nope.
No? And that concludes my physical examination.